911 Global Meds Disclaimer. This video and any contents herein are posted on this YouTube channel of 911 Globe Meds for informational and educational purposes only. Please see the detailed video contents disclaimer and the copyright disclaimer in the text section below.
Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Paliperidone. Its brand name for the injectable formulation is Invega. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So paliperidone palmitate is hydrolyzed to paliperidone, which is the major active metabolite of risperidone. Its activity is thought to be caused by the antagonism of both central dopamine D2 receptors as well as serotonin 5-HT2A receptors. It also has antagonistic properties on the alpha-1 adrenergic receptors, alpha-2 adrenergic receptors, as well as histamine receptors. In terms of indications for use, paliperidone is indicated to be used in the treatment of schizophrenia. And it can also be used to treat schizoaffective disorder, either as a monotherapy or as an adjunct with mood stabilizers or antidepressants. Now, before somebody was to use paliperidone, there is a contraindication that they must clear, which in this case would just be a hypersensitivity to paliperidone or risperidone or any other component of the product. And there's also some precautions and warnings that they should be made aware of. So in terms of precautions, this medication is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. We would want to avoid giving this medication in the elderly population who have behavioral disorders due to the increased risk of cerebrovascular accidents and mortality. QT interval prolongation has been reported with the use of paliperidone, so we would want to avoid giving this medication to patients who have cardiac arrhythmias or congenital long QT syndrome. Hypotension or syncope, also known as fainting, has been reported with the use of this medication, so it should be used cautiously in patients who have cardiovascular or cerebrovascular diseases or have other conditions that put them at an increased risk of developing hypotension. Elderly patients who use this medication would have an increased risk of developing tardive dyskinesias, especially elderly women. Hyperglycemia or high blood sugar levels have been reported in patients using atypical antipsychotics such as paliperidone, so this should be monitored during therapy. Patients with diabetes or patients at risk of developing diabetes have an increased risk of experiencing hyperglycemia, again high blood sugar, while using this medication. Patients should be made aware that weight gain may occur with the use of atypical antipsychotics, and dyslipidemias have also been reported. This medication should be used cautiously in patients who have conditions that may elevate their body temperature. Falls that could lead to fractures may occur with the use of this medication due to the somnolence or postural hypotension that could occur. Anaphylaxis, angioedema, and other hypersensitivity reactions have been reported with the use of paliperidone. And finally, esophageal dysmotility and aspiration may occur with the use of this medication, so it should be used cautiously in patients who are at risk of aspiration pneumonia. So if somebody is going to use the injectable formulation to treat schizophrenia, first they would want to have established tolerability using oral paliperidone or injectable risperidone before this medication is given. They would typically give 234 milligrams intramuscularly in the deltoid muscle on day 1, and then give 156 milligrams intramuscularly 1 week later. And then 5 weeks after the initial dose was given, they would start to receive 117 milligrams intramuscularly monthly for maintenance therapy. The dose could be adjusted monthly with a range of 39 milligrams to 234 milligrams still given monthly based on efficacy and tolerability of the medication. And patients should be made aware that it may take several months to achieve maximum efficacy of this medication. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using paliperidone, so we'll go over some of those here now. Up to 12% of patients may experience an injection site reaction. 32 to 55% of patients may experience hyperprolactinemia. Weight gain may occur in 5 to 18% of patients. 1 to 6% may experience dizziness, and up to 12% may experience extrapyramidal side effects. Up to 15% of patients may experience a headache, and up to 18% may experience Parkinsonism. 4 to 10% may experience agitation, and some patients may experience somnolence as well. Now, some more rare but serious side effects would be orthostatic hypotension, or a sudden drop in blood pressure when going from a seated to a standing position, prolonged QT interval. Less than 1% may experience syncope or fainting. Less than 1% may experience a seizure. Anaphylaxis may occur, as well as priapism. That's all we're going to talk about today with Paliperidone. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.